Today we are presenting Oral Health by Ashley Gahagan and Sina Onodera. The importance of oral health. Good oral hygiene is essential in determining a person's overall status of health, and this is because of the mouth's proximity to the brain and the heart. Everything is connected, it's so closely related that oral health can affect all parts of your body very quickly. It's a task that we often do not think deeply about, but we should. We don't really sit there and think about brushing our teeth every day and if we got all the corners, but again, we should, and I'll show you why. Before we begin, here are 6 ways to care for your mouth. Brush your teeth twice daily with fluoride toothpaste. Drink fluoridated water. Avoid sugary snacks and drinks. Visit the dentist regularly. And avoid all forms of tobacco and limited alcohol. Lastly, if you do have diabetes, work with your doctor to keep your blood sugar close to your target level. All of these preventative interventions will help your status of oral health and help your overall health. Some of the dangerous or negative outcomes that are associated with oral health include tooth decay, gingivitis, and periodontitis. Some of the more extreme conditions that may result from poor oral hygiene can include endocarditis, which is inflammation of your inner heart lining, heart disease, and premature birth and low birth weight if you are pregnant. Now again, like I said, because your mouth is in such close proximity to your heart and your brain, any of the infection or germs or bacteria can easily spread there, which is how all these diseases may occur. Here we just have demonstrated an illustration of periodontitis and how it can escalate quickly. The first picture is a picture of healthy gums and tooth. The second is gingivitis stage. The third is periodontitis. And the fourth is advanced periodontitis. So you can see how quickly it will affect it and how severe the damage can be and how it will affect your daily life. Lastly, we have risk and protective factors. Some risk factors we have are not brushing your teeth, using tobacco, excessively eating of sugary drinks or foods, and alcoholism. However, some protective factors that you may engage in are regularly brushing and flossing, including switching out your toothbrush every few months, regular dentist visits, and a healthy diet. Some of the social consequences that may result from poor oral health may be being stereotyped as unhealthy or dirty. This could result in poor self-esteem due to poor self-image. If you have people staring at you all day looking at your teeth and your gross smile, and it might affect you, and it might affect your professional life as well. If you are the face of your company, they probably don't want someone who has tooth decay. And lastly, financial consequences will arise. It'll cost thousands of dollars to get your teeth fixed as well as getting the other complications fixed. And again, here's another illustration just showing you some of the poor effects of negative oral health.
Next, I will be talking about personal impacts on poor oral health. Oral health affects people psychologically and physically. As a psychological impact, it might influence how people enjoy life, how they look, speak, interact with people, chew, and taste food. Also, it might decrease quality of life by experiencing pain, discomfort, acute and chronic infections, and sleep and eating disruption. There will be higher risk of hospitalization. As a result, people might lose their school or work days. Even though you care about your oral health, you may see these symptoms. They are signs that you should go to see a doctor. Red, tender, or swollen gums that bleed when you brush or floss, changes in the way your top and bottom teeth align with each other, unusual sensitivity to hot and cold, persistent bad breath or unusual taste in your mouth, difficulty of swallowing, and mouth sores that don't heal long time. Because early detection and treatment of problems with your gums, teeth, and mouth can help ensure a lifetime of good oral health, it is important to take care of your oral health and go to see a doctor as soon as possible if you see these symptoms. Here are the references. Thank you for listening.